is Scott Kennedy. I'm the Director of Marketing and Corporate Communications at Connexall. Joining me today are...
I'm Karina Manchester. I am the Clinical Solutions Specialist with Connexall and a registered art nurse.
Thank you, Karina.
And I'm Denise Tyler. I'm a Clinical Informatics Specialist at St. Agnes Medical Center, a part of Trinity Health.
Thank you very much, Karina and Denise. Denise, how would you differentiate telehealth versus telemedicine?
Well, Scott, telemedicine is kind of what you do when you replace the in-person office visit with a patient visit, and it's online instead. Whereas telehealth has a much broader range. It includes meetings, it includes planning, it includes education with the patient than a nurse would do. It's a much broader term, and it encompasses telemedicine, but it includes a lot more.
Okay, thank you. Denise, what role do nurses play in telehealth?
As with any informatics implementation or optimization, nurses play a huge role in the telehealth platform. They make sure that it's usable, they test it, they test any upgrades to make sure that when fixed didn't break something else. They play a role in education, and part of education is really marketing to both the community, the patients, and the staff on why it's a benefit to use this platform. And they play a huge role in education of the patient and the community and the staff in how to use it successfully.
So Denise, I've noticed that telehealth has really come to the forefront when it comes to COVID-19. And I was wondering, how has telehealth impacted the mental health of caregivers?
It's added another stressor initially. It's one more thing that we've had to learn, that we've had to incorporate into our practice and workflow. And anytime you introduce something new, a change, it's stressful, even if it's for the better. I think as people have started to use it more and incorporated it into their workflow and practice, that it's actually decreased it, that you have fewer patients showing up late. If they do show up late, it's easier to call someone and add them in. Some practitioners are even working from home to do office visits. So I think it's a mixed bundle as far as mental health.
Thank you. Karina, with your nursing experience and now being at Connexall, where do you see the opportunities for telehealth, and where do you see next steps?
So next steps and opportunities with Connexall and our telehealth solutions are to improve the patient outcomes, which come as a result of nurse-patient interactions that are much more efficient and, as a result, much more compassionate. We get alerts from either our telehubs or through the devices that signal to the nurses to prioritize one patient's care and needs over another. So when the nurse goes into the room, they are totally focused on that patient's needs and can respond to the patient holistically, not just the cause of the initial alarm, but also how the patient is reacting to whatever is causing the alarm and the treatments that come along with it. So I really see that Connexall is improving patient outcomes through the opportunities of telehealth and telemedicine.
Thank you very much. Denise, from a deployment and adoption perspective, what makes a successful telehealth program?
It needs to have an organized implementation and a plan for optimization to improve it. It's very, very important that it's easy to use, or the term we use in informatics is often usability. It needs to be easy for me as a nurse to use it, for the provider, and more importantly for the patient. If they have to download multiple applications, or if each application is different, that's going to decrease my satisfaction as a patient in using it. It also, if at all possible, needs to interface or be interoperable with the other applications. As a nurse doing double documentation to enter things, it's time consuming, it interrupts my workflow, and it increases the chance of error because I might say it differently or record it differently or do a typo.
Okay, thank you very much. Brady, from a service perspective, how is Connexall helping hospitals with their telehealth needs?
From a service perspective, Scott, we actually have two solutions. Our biggest telehealth, our telemedicine solution is the telehub. It's where the techs in a central room monitors the patient's vital signs to look at those alerts, look at those vital signs, send them to the nurses, and tell the nurses when this vital sign is a priority and needs to be looked at. This helps the nurse organize her day and also manage those last minute changes that happen in a patient's status. We also have our alerting systems that go directly to nurses' devices. And those also, because we work really closely with the hospitals to design those alerts and prioritize them according to urgency of need and escalations, that we can also remotely monitor patients from different areas within the hospital. And it allows the nurse, again, to organize her day and respond to those patient changes that can happen so quickly within the hospital system.
Thank you.